But first, we're going to check in with Jim Spiewak, who spoke with that epidemiologist we just mentioned and an exhausted nurse about this wave. Jim.
Yeah, so hospitalizations, people going into the hospital usually go down, or they usually lag when cases go up. And the data is showing with Omicron that hospitalizations actually go down by about 25%. But the fear is that so many more people are getting infected with this variant that these hospitals might fill up again.
This is the most transmissible, most rapidly rising virus that we've really ever seen.
Dr. Andrew Pavia, the chief of Pediatric Infectious Disease at the University of Utah Health, says the only other known virus more transmissible than the Omicron variant was the measles back in the pre-vaccine era.
I've been studying infectious disease epidemiology for over 3 decades. I think we're all kind of stunned.
Dr. Pavia says it's not cause for panic. He says vaccinated and boosted people have great protection, but he is concerned, however, that these record-breaking numbers don't yet account for kids who are now back in school.
So I suspect it's only going to get worse, and possibly a lot worse.
Typically, frontline workers bear the brunt of the surge, like nursing director at Intermountain Healthcare, Sean Talley.
We thought we were tired before, but we're extra tired now.
Talley says frontline workers have evolved their workflow over the course of the pandemic. He regularly sees positive outcomes from people who are vaccinated and end up in the hospital.
It's remarkable to see how well they can deal with this illness once we've given them that option.
Busy, yes, but Talley still looks at the numbers. And today he saw more than 7,200 new cases.
For us, it's informational. Here on the front lines, the people that see that, I think we just see that and know that we have some extra work coming and be ready.
And so while it's not known just yet exactly how long it will take for Omicron to work its way through the state and our communities, it's expected that it may work fast based on the data that we're seeing right now. And so a lot of health experts are saying they would really like to see students in masks at least through the month of January while Omicron makes its way through the state. We're live in Murray tonight. Jim Spiewak, KUTV 2 News.
The Utah Department of Health holding a news conference just today. We carried it for you right here on air on KUTV Channel 2. The state epidemiologist noting today that while we can say Omicron is more mild, that doesn't necessarily mean that hospitals are not going to fill up.
Even with a milder disease, if you have a very large portion of the population infected, we're going to still have a lot of hospitalizations. And as I think many people know, our hospitals have been overwhelmed for 4 months.
And we're learning a key part of fighting the Omicron variant is the booster shot. But a number of Utahns are not returning for it. Haley Crumbleholm is live in Salt Lake City. Now, Haley, this is a change from when we were focused on the Delta variant.
Yeah, that's right, Kelly. The state epidemiologist says that 2 shots was pretty good at protecting you from Delta. But with Omicron, it's just a different story. And at this point, the state health department says as of today, only about 35.1% of adults in Utah have returned for their booster dose.
State ones.
Today, Ed Altamirano finally checked a booster off his to-do list.
I went down to the Salt Lake Central station and got my booster. I saw that UTA was doing a little pop-up clinic there, and I've been kind of having trouble finding last-minute appointments.
He could have gotten his 3rd shot sooner.
I got my 2nd dose way back in April. It's been a while.
So why the wait? Altamirano is a full-time student at the U, and he has a job and extracurriculars.
I wasn't against getting a booster. It was kind of just like, I'm going to try to go do this, I'll be fine.
With only about 35.1% of Utah's adults returning for their booster dose, Dr. Leisha Nolan, the state epidemiologist, says a number of people probably feel the same as Altamirano.
I think until now, a lot of people felt, I got my 2 shots or I got my 1 Johnson & Johnson and I'm good. There's no need to go to the next step.
And Dr. Nolan says with Delta, that was generally true.
Even without the boost, you were fairly protected against Delta. Unfortunately, Omicron is different. And really, people need to go get that boost to get the Omicron protection.
Today, Altamirano joined the 35-some% who got a boosted level of protection. He's glad he'll have it when he heads back to the classroom.
I'm definitely glad for that, for sure.
Now, coronavirus.utah.gov can help point you in the direction of vaccination locations close to you. Now, coming up at 6 o'clock, we speak with Dr. Nolan about what to do if you're gathering in large groups, what tips you have, and why it's probably not a good idea right now. Live in Salt Lake City, Haley Crumbleholm, KUTV 2 News.
Thank you, Haley. Well, we know this feels like deja vu for many of us, so be sure to stay with us as we navigate this surge amid the Omicron variant. You can download our KUTV 2 News app or visit our website for all the latest information.
Well, just yesterday, a former University of Utah researcher met with the head of the state's privacy division to discuss her experience with the university's management of students' data.
And this after a 2 News Crisis in the Classroom report detailing how the U may have put your kids' data at risk. Chris Jones has that update tonight.
Dr. Judith Zimmerman was fired for asking questions about student data privacy. The firing and the court case that followed eventually led to some big changes in state law.
I believed what they were asking me to do was to do something illegal.
In 2012, Dr. Zimmerman blew the whistle on the University of Utah. She questioned how the U was handling the personal information of K through 12th grade students whose data was being collected for an autism study. Her lawsuits prompted a change to state law. After her case came to light, State Senator Jake Anderegg forwarded a bill that required the state to tell parents that their students are being included in the study. The Anderegg law gives parents the right to opt their kids out of that study.
Yes, that was the one the legislature carved out.
David Soleil is the chief privacy officer at the state education office. His job is to make sure the state follows student privacy laws. He says contacting his office is one way to opt out of sharing your child's data.
So they would contact our office and say, I don't want you sharing my information with them, and we'd take their child out of the data set.
Soleil says we're lucky in Utah. There's more accountability towards student privacy in Utah than somewhere without an office like his.
If people just knew we existed, I think that we could address a lot more concerns and issues.
Yes, indeed, the university retaliated against me.
As for Zimmerman, she believes the university should be investigated to ensure that it follows proper privacy procedures now.
Since there's been no accountability, I'm have no faith that it's being done correctly or that contracts are being followed.
Guys, as a postscript, Dr. Judith Zimmerman was awarded $760,000 by a jury because of her firing. Guys, back to you.